Hello everyone, I just wanted to welcome you to this course, Behavior Therapy and Relationships, how we use behavior modification techniques to improve your relationships. Behavior therapy is also called behavior modification and cognitive behavior therapy. The basic aim of behavior therapy is to help people deal with psychological problems. Its principle and procedures also are used to modify everyday problems. In this series of lectures, I will focus on both theory and application. You will learn all about behavior therapy and modification techniques and how to use these principles to positively modify behavior. People engage in specific actions to alleviate their problems. I must throw in a little disclaimer here. These series of lectures are for educational purposes only and not clinical mental health therapy sessions. You will learn theories and applications of well-established laws of learning, such as terminology and common characteristics of behavior therapy, antecedents of contemporary behavior therapy, to include the historical and formal beginnings of contemporary behavior therapy. We will move on to the behavioral model, all about covert and overt behaviors. Why do we behave the way we do? I will also introduce you to what we call the ABC model. And we'll move on to the process of behavior therapy. There are different steps to the process, to include clarifying the problem, formulating initial treatment goals, and designing a target behavior. It's also wonderful that we are able to identify and maintain conditions and design and implement a treatment plan. And at the end, we'll talk about evaluating the success of therapeutic goals. In acceleration behavior therapy, you need to know what a controlled stimulus is, what prompts certain events, and also how to control these stimulus and in what perspective. We'll also learn all about reinforcement, positive versus negative reinforcement, and the different types of positive reinforcement. We will learn about acceleration and deceleration behavioral therapy, combining reinforcement and punishment. I'm sure a lot of you have heard of exposure therapy before. We will dive into that too, talking about progressive relaxation as a competing response to anxiety. And a favorite that most of you guys have heard of, cognitive behavioral therapy and coping skills, to include self-instructional training, problem-solving therapy and training, stress training, cognitive behavioral couples therapy, all things considered in cognitive behavioral coping skills. There's also a third generation behavioral therapies that talks about acceptance and mindfulness-based interventions. We'll also dive into the applications of behavior therapy to both medical and psychological disorders. And as you will see, I have chosen to correlate these theories on applying strategies to real-life relationship situations. Most of my students enjoy when I talk about love and relationships, so I've chosen to actually talk about real-life relationships. Now, again, these lectures are not mental health therapeutic services, but rather education on behavior modification techniques for positive personal development. So, come along with me. I'm sure you will enjoy each and every lecture. And remember, in this series of lectures, I will focus on both theory and application. You will learn all about behavior therapy and modification techniques, and also how to use these principles to positively modify behavior.